Hi, I'm Rebecca Harris, and welcome to this edition of Senior Moments. On Senior Moments, we focus on things that are important to senior citizens as well as any other age person. And if you know a senior citizen who might be someplace where there is no air conditioning, we want to encourage you to bring them up here to the Central Activity Center here in Phoenix City. All of the rooms are air conditioned. There's plenty of activity for them to do during the day, but it is very, very dangerous for them to be at home with no air conditioning, and sometimes fans can be very dangerous because you feel like you're cool when you're really not. So we want to ask you to please take precautions and take care of that. Today at Central Activity Center, we are at Brunch and Learn, and we have a speaker with us today, Patrick Gilbert, and he's with Encompass Health. And I'm going to let him tell you a little bit about what Encompass Health is.
Encompass Health, we have skilled nursing, we have physical therapy, occupational therapy, speech therapy, and what we do, we help seniors at home. Anytime that a doctor says, okay, we may need a little medication management or physical therapy or dehydration awareness, things like that, they give us an order and we can go in and help the seniors with that stuff.
All right. Well, I know Miss Pat Harrell is the coordinator for Brunch and Learn, and she had told me that you were going to come today and talk to us about dehydration. So can you tell me a little bit about what your talk is going to entail?
Absolutely. One of the things that about dehydration is as we age, for seniors, it's hard for them to realize, hey, I'm thirsty. Our thirst sensation kind of deteriorates a little bit.
Right.
And it's so easy to get dehydrated, and dehydration is one of the leading causes of hospitalization in America for seniors. And people don't realize that. So it's very crucial to drink water, to stay hydrated as we age.
Well, it's very obvious to us when we're outside doing a physical activity and we're thinking, I need to take some water with me, or, you realize that you're thirsty. But when you're indoors, and especially in the summertime, even in the winter, and you're not really thinking about drinking water, we need to make this a conscious effort.
Yes.
So one little tip that I would like to give you is you can use your cell phone. Set a timer on your cell phone that reminds you it's time for you to drink some water, because we get involved watching a TV show or doing a little activity that we like to do at home, and then before we know it, half the day has gone and we have not had any water.
That's right. And if you feel like you're thirsty, you're already starting to be dehydrated. So stay on top of your thirst.
Well, I have a quick question before we go into your speech. There's a lot of controversy right now about drinking water out of water bottles, out of plastic water bottles. What are your thoughts on that?
It's fine. I drink bottled water all the time. One thing you don't want to do is get it hot, cold,
Right.
and you don't want to leave it in a vehicle where the heat can cause any kind of sedatives or anything from the water bottle to get in there. But if you go from the store to a refrigerator, it's perfectly fine.
Right. It is more convenient for us to drink water out of water bottles, but for recycling purposes, if you please recycle those plastic bottles, and also try not to drink out of plastic if you can help it. Invest in a good stainless steel cup or a glass and try to drink your water out of that. And I know that you're going to cover so many things that I'm interested in about dehydration, so we're going to ask you to go ahead and get started with your talk this morning. And Patrick, I want to thank you for coming out.
It's
and
my pleasure.
I've known you for a long time.
You have.
You are a pastor.
That's right.
Where are you a pastor at?
I'm the associate pastor at Fairview Baptist in Columbus.
All right. I know all about Fairview because my granddaughter grew up going to that church. So it's an awesome church. And if you have any questions about anything you'd like to get in touch with Patrick, I'm sure he would be happy to talk to you at any time. He works at Encompass Health, and also he is the pastor at Fairview Baptist Church. So let's join Patrick for his speech now. And thank you so much for coming out today.
Thank you for having me. My name is Patrick Gilbert. I'm an area manager with Encompass Home Health. I'm also the associate pastor at Fairview Baptist Church in Columbus. A little bit about myself, real quick. I am married, been married for 20 years. We have 3 grown children and a grandchild. So I am a grandfather. I know, don't let the baby face fool you. I'm also an exercise junkie and fitness junkie. I know you probably can't look at me and tell that, but I'm a lot better. I was a college athlete. I played baseball and basketball at University of North Florida. Got done playing, and I got up to about 420 pounds about 5 years ago. So I made the decision to change my life as far as what I was putting into my body. And I started exercising, and I lost over 200 pounds by doing that. But I had a little bit of a hiccup along the way. I was doing so much exercise and I was sweating so much that I was going through issues, and I was having spells where I would forget how to speak. Now, being a preacher and talking for a living, doing what we do at Encompass Home Health, that caused an issue. And so it would hit me all of a sudden, and I knew what I wanted to say. It came to my head, but I could not get it to come out of my mouth. And it would last a couple of minutes, and it freaked me out. I don't know about y'all, but it freaked me out. And so I went to a neurologist, I went to my doctor, they sent me to UAB, and I sat there with the stuff all over my head for a week, and they monitored me. My heart rate was dropping. When it happened, my heart rate would drop into the mid-30s. That is not good. And so they did all this stuff to try to figure it out. They sent me back to a cardiologist here in Columbus and put me on a heart monitor, and every time it happened, I had hit a button, and it turned out that I was losing so much fluid that I was dehydrated. Now, I had no idea that dehydration could cause that kind of an issue, but it did. And I'm fairly young. I'm not young anymore, but I'm fairly young and I'm fairly healthy and I was active. Now multiply that by about 100 when you get up in age. Did y'all know that dehydration among seniors is one of the leading causes of hospitalization in this country? Thousands and thousands of dollars is being spent because seniors are not hydrating properly. Fluid loss can be very serious. It can even be fatal, as water is the most common substance in the body. Now today, the purpose of me being here today is to increase awareness about how important hydration is. And as we age, our thirst response can be blunted, and our body may not receive the same signals in a timely manner that we are getting dehydrated. Now listen, one of the most common things I want you to remember, if you don't remember anything else that you hear today, I want you to remember, by the time you feel thirsty, it's too late. Okay? So you need to stay on top of your hydration by drinking water throughout the day. Do y'all know our bodies are made up of 65% water? 65% water. So therefore, this element is crucial to virtually all of our physical functions. Every organ, every system of the body depends on water. So a shortage of fluid can naturally lead to serious health consequences. Now, surprisingly, like I said, dehydration is one of the most frequent causes of hospitalization among people over the age of 65. Now, I want to do some interactive stuff. So I'm going to ask some questions, and I'm going to give you multiple choice answers. And I want you to tell me which you think is the right answer. The first one's a gimme because I just said it. What percentage of the human body is composed of water? 65% is composed of water. Now, why is hydration important? Blood, lymph, mucus, stomach acid, lung tissue, and tears are all made with water. Skin, muscles, and organs, especially the brain, are all made up predominantly of water. Water also aids in digestion, temperature regulation, metabolism, and waste removal. An aging body is less efficient at using and retaining water, so the overall need for water increases. If severe enough, dehydration can lead to confusion, as what happened to me, weakness, urinary tract infections. Have anybody ever had a urinary tract infection? That can wreak havoc on your body. It even can cause bed sores in bedridden patients and even death. In general, y'all know a human can only survive about 4 days without any type of liquids. Now, I don't know about y'all, but I kind of like my TV, and we DVR everything. We record it and watch it later. Now, now it sounds awful, but there's a show called Naked and Afraid on Discovery Channel. Have you ever watched it? Yeah. Now, they blur out all the stuff now, so it's not like it's being nasty, but they send 2 people out on a deserted place for 21 days with no water, no food, anything. And if you ever watch that show, they can go the whole 21 days without eating. But the first thing that they have to do is find a water source and find some kind of clean water, because our bodies are not designed to go without water. Hydration is important to help regulate body temperature through sweating, to maintain blood pressure. Now listen, if you get dehydrated, your blood pressure is going to be awful. And to eliminate body waste. Y'all know that, that holding on to body waste is absolutely horrible. My wife just spent some time in the hospital because of a colon infection, because her body wasn't getting rid of the waste like it should. And so dehydration, it can cause that, and drinking water helps with that. In older adults, adequate hydration has been associated with fewer falls, lower rates of constipation, and better rehab outcomes. All right, question time. What percentage of watermelon is made up of water? A, 70%, B, 80%, C, 90%, or D, 95%?
80%.
90% of a watermelon is water. So listen, if you don't really like the taste of water, there's all kind of stuff that you can do to get hydrated a little better. Watermelon is a great source. Now, what are some of the causes of dehydration? Now, understand, listen, it's hot. I don't know about y'all, but it's like sitting on Satan's porch out there right now. It is hot. And so you start to sweat. And living in the South, in Alabama, the humidity is awful. And you just sweat. So some of the causes of dehydration are frequent urination and diarrhea, summer heat and high temperatures, diuretics and other medications, strenuous activity. How many marathon runners we got in here? High fever and prolonged vomiting, excessive caffeine and alcohol can lead to dehydration, and reduced intake of fluids. Some of the symptoms, we talked about this a minute ago: confusion, problems with walking or falling, dizziness and headaches, dry or sticky mouth and tongue, sunken eyes, inability to sweat or produce tears, rapid heart rate. All those are signs of dehydration or symptoms of dehydration. Low blood pressure or blood pressure drops when changing from standing or lying to standing. Y'all ever get that feeling and you feel like you got to hold on? You need to up your water intake. That's a symptom of dehydration. Constipation or decrease in urine output. Also, a great way to check for dehydration is for a decrease in skin turgor. Now, what does that mean? That means if you grab the back of a hand and pull up, and on a normal hydrated person, it should go back to normal. But if you're dehydrated and you do this, it's going to the skin is going to stay there for a little while. And that is a sign of dehydration if that happens. Now, elderly dehydration is especially common for a number of reasons. The main reason for elderly dehydration is medication. So if you're on a high blood pressure medicine or any kind of antidepressant, they are diuretics, okay? So they are designed to get rid of fluid. And so if you're on any of those, you need to up your water intake. You need to make sure that you stay hydrated because those things are designed to get the water out of your system. So that can cause you to be dehydrated. As we age, our sense of thirst becomes less acute. So we don't really know that we're as thirsty as we used to back in the day. Seniors have a harder time getting up to go get a drink when they're thirsty. So a lot of times we have to rely on caregivers to bring us something to drink. And they can't sense when we may need fluids. Now, as we age, our bodies lose kidney function as well, and we're less able to conserve fluid. All right, so question time. What is a good alternative source of water? A, hamburger. B, chicken breast. C, grapefruit. Or D, all of the above. The answer is D, all of the above. Now I know that sounds kind of funny, but listen, do y'all know a hamburger is about 60% water? A hamburger is about 60% water. Hydration requirements. 6 to 8 cups of water a day, depending on health status, fluid restrictions, etc. That's what you should be, at the least, that's what you should be consuming. 6 to 8 cups a day. Now, that doesn't necessarily have to come strictly from water. That can come from other sources as well. Sources for hydration are juice, some milk, fruits and vegetables. Y'all know that fruits and vegetables are almost all 100% water. Caffeinated beverages such as coffee and tea provide some hydration in moderation. But too much, like we said a minute ago, too much caffeine can harm you. The same goes with alcoholic beverages. If beer and wine and stuff like that, they may give you some hydration, but the alcohol can pull it right back out of you. Stuff such as gelatin and soups and ice cream provide some water. Although they're often high in sodium and fat, and a net gain of water is very minimal. Now, what can you do to stay hydrated? Drink water. Drink water. Eat watermelon. Do the things that we talk about today. Now, and if you know somebody that is having issues, and they're like, okay, that sounds like, because a lot of times when we hear health talks and we hear things, somebody pops in our mind, right? And so if somebody, listen, home health is a great resource to use. What we can do, what our clinicians can do, are go in and they can assess for signs of dehydration. We can teach how to avoid dehydration. Check fluid levels and monitor labs for electrolyte imbalances. We can teach energy conservation techniques. And we can perform a comprehensive evaluation determining the need for skilled services. So what I want to do now is I want to open up the floor for any questions you may have. Now listen, I may be good looking, I may have a lot of gifts, but I am not clinical. I am not a nurse. So lucky for us, I brought a nurse with me today. Come here, Susan. This is Susan Stevens. She's another area manager, but she's also one of our nurses at Encompass Home Health. And so if you have any questions, now is the time to ask. Because listen, there are no such thing as a stupid question, right? The only stupid question is one that you don't ask. Because I guarantee you, if you've got a question in your mind, somebody else is probably thinking that same question. And so the answer is not just for you, it's for other people too. So if you've got any questions, now's the time to ask. Who's got a question about dehydration?
Okay, you said about blood pressure. It messes with your blood pressure going down.
Okay, so when you're dehydrated and you don't have enough fluid, your heart doesn't have you can't produce enough blood in your system. So what happens is your blood pressure is going to fluctuate between standing, sitting, walking, and it's going to cause the dizziness. It's going to cause, the altered mental status. And so your body needs that water to produce the blood to be able to circulate, for your daily activities. So that's what happens is you don't have enough water, you don't have enough blood, and it just goes from there.
Is it possible to be overhydrated?
Yes, most definitely, most definitely. And what will happen is if you have too much water in your system, your heart is going to, it's going to overwork your heart, number one. Number two, you're going to settle in the outer cells, and it's going to cause swelling in either your abdomen or your lower legs, and it's going to cause weakness. You're going to be really tired, and it's going to cause an elevation in your blood pressure.
But typically, if someone is fairly active and they're not sedentary, especially in the heat like this, you're not going to have too much water intake.
Right.
Could I ask you, how about like if you drink a glass of water, you put lemon juice in it or fruit or something like that?
Yeah.
Is it okay to do that? I like to take like a cucumber, chop it up piece and put it in the water, and I fix a jar of it and keep it in my refrigerator.
Hey, I do that too. Because water is bland. I mean, and you want to have some type of desire to drink it. And if you have to spice it up, spice it up. As long as you're not a diabetic and you're not putting sugar in your water, go for it.
How do you know if your sodium is low?
How do you know if your sodium is low? That's a really good question. How do you know if your sodium is low?
You really, and that was also one of my issues. My electrolytes, I was losing too much. So my cardiologist told me, he said, you're the only person, I've been doing this for 19 years, you're the only person I've ever told this, but you need to up your salt intake. There was really,
blood work.
yeah, it's usually blood work that does that. So I have to drink a Gatorade about once a week. I have to drink a Gatorade because listen, Gatorade has a lot of electrolytes, has a lot of things like that in it, but it's got a ton of sodium. Yeah. So if your blood pressure is high or you're watching your salt intake, don't drink Gatorade. Okay. Right. But yeah, blood work is really the only way you're going to be able to find out if your sodium is low. All right.
Is there a relationship between dehydration and high potassium?
There is potassium levels. It usually is dealing with the heart. If you have a rapid heart rate, you might want to, and that goes right along with blood work. You really want to wait until you go and you get your blood work done, and that's how they know.
But if a person is dehydrated, would that possibly cause high potassium?
Yes, most definitely.
Anybody else?
How do you know that you drink too much water? My doctor told me I drink too much. I was losing weight, and I thought I was drinking more water.
Yeah.
He said I was drinking too much. I didn't think so.
The only way you're drinking too much water is if you start to retain water. and you're
Not when you're losing weight.
Well, that could go right along too with, if you're losing weight and your doctor's saying that you're drinking too much water, that probably goes along with you not eating enough. What water will do, a lot of people when they want to lose weight is they increase their water intake, and that reduces your appetite. So that might be where that's
I
coming
did
from.
have that.
Yeah.
She had to go to the phone 3 times.
Yeah.
It could have caused her an electrolyte imbalance.
Exactly. Yeah.
I didn't know how I was going to.
Well, and that goes right along with the blood work. I mean, he knows that through blood work. And it just comes from you going in, you're losing weight. He knows the symptoms. And so I'm sure that's why he went, got the blood work, looked at it, and then he knew exactly what the issues were. That's the importance of going to your 90-day physician's appointments and not canceling them because you think that you feel okay. Because you might feel okay, but it's only through that blood work that they can catch it ahead of time and go ahead and treat it.
Could I ask you about this electrolyte? How can you tell it's low or high?
Your electrolytes, that comes along with your symptoms. If you're, okay, so she's asking about how do you know that you have an electrolyte imbalance? That's what you're asking, right? That comes from the symptoms, the dizziness, the altered mental status, kidney function, anything like that. You go into your doctor, you let them know the symptoms that you're having. They do blood work, and then they tell you what you need to do, and you follow those to the T.
yeah. Fatigue is a big one for electrolytes too.
Yes,
If you feel overly fatigued, your electrolytes may be off.
right.
Yes, sir.
She's had her hand
There are a
up.
lot of diabetics here. Are there any special rules they need to follow?
As far as dehydration, pay real close attention to all the symptoms that he said today, because diabetics are very prone to getting dehydrated. Very, very prone. So, yeah, diabetics really need to drink that, 8 ounces a day?
She wants to know how do you know when you get what?
Hydrated.
How do you know
When you're hydrated.
Yeah, I can't remember.
when you're hydrated or dehydrated? When you're hydrated? Well, you know when you're hydrated when you're, you're not fatigued. You have
Tired. Overly tired. Now, it's normal. Listen, when we get old, like me, I get tired pretty easily now.
Oh, I get tired, I get,
But
the best way to know is what Patrick was saying, skin turner. That's the best way. Yes. If you pull your skin up like this and it sticks, you probably need to increase your fluid intake. That's the best way to know that you're hydrated.
It didn't stick.
Well,
That's
then you're
good.
hydrated.
You're all good.
Oh,
You good?
oh,
That's the simplest, easiest way to know that you are hydrated or dehydrated. Is skin turner. Your skin will tell you.
yeah. Thank you.
But, on the diabetic thing, one of the things you got to make sure of is, like Susan said a minute ago, a lot of people put drops and packets and stuff in their water bottles and shake it up. A lot of those are straight sugar. So I would avoid anything like that unless,
Use fruit.
yeah, fruit is a great
Yes.
way to flavor your
Use
water.
fruit.
And what we'll do sometimes is we'll chop it up the night before, put it in a big jug and let it sit overnight in the refrigerator. And it's called fruit infused water. And then it takes on the flavor of the fruit. It's not as strong as just eating a piece of fruit, but it gives you that little hint of flavor. So it's not like just drinking regular water.
But she wanted to know, you buy these little package in a box.
At Dollar Tree.
Yeah.
And you take 1 hour.
Yeah.
I would be careful with those because either they're sweetened with sugar are an artificial sweetener, which is just as bad, if not worse, than sugar.
Really?
Yes.
Yeah.
So in moderation, it's okay. Now, if I wouldn't drink 10 bottles of water, putting that stuff in it every time.
No, I didn't drink one at night and one in the morning.
Yeah, and in moderation, it's okay. I would just be careful not doing it too much.
Oh, okay.
Yes, ma'am.
I've always heard that tea is very bad for your kidneys. My husband drinks a lot of tea for his hydration and he's diabetic. It's definitely not good.
That's not good at all.
Yeah, the caffeine is what's bad for your kidneys.
Caffeine and sugar. especially
Caffeine and sugar.
Diabetic, he really, if he likes tea, try green tea. Green tea is better. I mean, I know, this is the South.
This is the South, especially you can't eat barbecue without sweet tea. You just can't do it.
Yeah. But, you know, if you want to live out the rest of your days, you're going to have to alter the fact that our bodies are getting older, and we have to alter to our bodies because our bodies have carried us this long, you know, so now it's time for us to pamper our bodies and do what's right for our bodies.
One of the things that I do too to make sure I stay hydrated is the first thing I do in the morning is drink a big glass of water. That gets me going. It wakes me up and it helps your digestion get going. So try that first thing in the morning. Drink you a big glass of water.
Protein and glucose in your urine. Are you diabetic? Yeah. It means have you checked your A1C lately? So your sugar's high, is what that means. You could be, yes ma'am.
What about decaffeinated tea is called?
Decaf? That's fine. Yeah.
So if he drinks decaf, wouldn't that be?
Decaf is fine, but he's got to watch the sugar. He's diabetic, so, and that's why he's drinking the tea, right?
And there's that pre-sweetened tea now that says 0 sugar, 0 carbohydrates. It's by Lipton. We buy that, but it does have caffeine in it.
Yeah, see, and there you go. You know, the caffeine is the caffeine. What caffeine does to your body is it dilates the vessels and the arteries. It just dilates everything. And so when that happens, you're losing fluid a lot faster than your body can retain it. So you can, if you're drinking caffeine, and you're constantly losing fluids, and so that's why he needs to kind of avoid the caffeine.
Well, years ago, my doctor put me on the decaffeinated tea. He said if I had to drink tea, and usually when I have my dinner, I only have one glass. That's all I have here. But I always fix it. I put my husband on.
And the cool thing is, you could probably switch it out, and they won't even know the difference.
Yeah,
You can't do. I can't right. You.
yeah. It's
I'm not advocating being sneaky,
Asta.
because I'm a preacher. But be sneaky if you have to.
We drink decaffeinated tea, but my husband just wonders.
You know, I'm going to tell you, the sweeteners, people like to use those type of artificial sweeteners, and they're not better than sugar. You know, I mean, the artificial sweeteners have all kinds of other chemicals in it that you want to avoid.
And this doesn't have anything to do with dehydration, but if you see the word aspartame,
Yes.
if you see the word aspartame in anything that you're putting into your body, stop.
Yes.
It is one of the ingredients in rat poison.
Yes, ma'am.
Oh, I was just going to say, similar to what you were saying about the sweeteners versus sugar,
Right.
the same argument goes for margarine versus butter.
Amen. Yes. It's just like Patrick was saying, everything in moderation.
I drink old coffee. I'm a diabetic. And my daughter, she had just holds so strong. Can a diabetic drink coffee?
In moderation.
You don't put sugar in it, do you? You put sugar in it? Then no. Then no. You shouldn't drink it.
She said black.
No, yeah, I put sugar in.
Yeah.
But I can't drink it.
Yeah, don't drink it.
Don't drink
If you said you can drink it
Without sugar.
without sugar, then I would try to.
Oh, what can I drink then in the morning time?
Water.
Water.
Look at that thing. I just put a whole
Listen,
finger on her day.
one of the problems in America is that we live to eat and drink, and it should be the total opposite. We ought to eat and drink to live. That doesn't always taste the best. It doesn't always fulfill us like it used to. But that's one of the things that we have to do. We have to take care of our bodies, especially as we get older. We have to drink water. We have to do the things that we don't necessarily want to do in order to stay healthy.
Is it true that drinking too many dark sodas can be dangerous?
Absolutely.
She asked if it was true that drinking too many dark sodas can damage your kidneys. And that is absolutely true.
Now, therefore, if I need to talk about what is right, the water, if she would put fruit or lemon juice in that water.
What can I put in that water?
Fruit, oranges, or any type.
Whatever you feel like. You can put a bunch of them in there together.
That's the way I drink mine.
If you drink a soda, is it preferable to drink like a Sprite over a darker soda?
Most definitely.
Absolutely.
Oh, okay.
Especially Sprite because it doesn't have caffeine in it.
If you feel like you have to have a Coke or Dr. Pepper or a dark soda, drink it, but then drink a bottle of water afterwards. Try to flush that stuff out.
Can I drink a Sprite?
Yes, ma'am.
Yeah.
Was a Sprite healthy? Poison?
If you're diabetic, don't drink the regular stuff because it's got sugar in it.
Yeah, drink Sprite Zero. Sprite Zero tastes just as heavy as Sprite. Never mind, don't drink Sprite Zero.
All right, anybody else got any questions? Well, thank you guys. We enjoyed being here, and we're going to be here again next month to do the blood pressures. But once again, if we are with Encompass Home Health, so if you know anyone that could possibly benefit from home health, feel free to give us a call. And we're going to leave a couple of our brochures up here on the table, so feel free to grab one.